Good afternoon, everyone. Hopefully everyone can hear me okay. All right, so I want to start with the understanding the influence of the virtual healthcare. So initially, when telehealth first came out, the focus was to educate and bring specialized care to underserved areas, also saving time for the patient and its provider, as well as public health staff. Since then, we've kind of grown a little bit, and we also look at telehealth as a way to improve our cancellation and no-show rates. Majority of these issues that we currently see that deal with telemedicine are the gray areas that no one has explored, such as the payers. Some payers are flexible to the new telehealth, wave, and some are more so. We'll just lean to the understanding that Medicare, Medicaid, services provided to us by CMS guidelines. Telehealth growth. All right, so a little bit about the growth. So it said as of May 2019, we've seen 53% faster growth than any other place of care, which says a lot. Because in 2016, we only had 11 states that adopted telehealth and telemedicine. With the rapid telehealth growth, there's an increase in claims, as well as updated information and new telecommunications. So we're seeing a lot of that now with the, pop-up overnight telemedicine platforms. Telehealth growth and the payers' reaction to that growth. All right, so this is a really interesting point. There are several telemedicine platforms that are available to you. However, several have been aggressive about being proactive in the telehealth wave. Global Med, MD Live, Amwell, Doctor on Demand, eVisit. So I picked these couple of telehealth platforms out simply because they've taken a different approach than a lot of other platforms that are available to us. MD Live, Amwell, they've partnered with Cigna, and they're saying that, Cigna is saying that the only way we'll reimburse for our visit, for the patient's visit, is if you use an MD Live, Amwell platform. I think Blue Cross Blue Shield is using Doctor on Demand. So the impact that telemedicine is having on the policies. Earlier this year, we've invited 50 states to be a part of the live video for telemedicine reimbursement. This was given by AMA. Spring of 2019, the Center of Connected Health and Policy met with the state policymakers and early interested healthcare professionals to serve as a telemedicine advocate, which is really phenomenal. A lot of people are kind of skeptical about telemedicine and where we're going with it. Lawmakers were encouraged to pour into this idea and embrace telemedicine through policies, law, regulations, and now it's in all 50 states, including District of Columbia. The next steps on telemedicine improvement. All right. So CMS has partnered with AMA to establish a digital medicine payment advisory group known as DMPAG. They're working to improve innovation, regulations, code, pricing, coverage, liability. Additional areas of focus will be coding and payments, digital medicine matrix, augmented intelligence, and advocacy focus groups. All right, so with coding and payment, they're creating a taxonomy code for digital health. They're reviewing the face-to-face service definition in the age of digital medicine, which is a big step. So performance measures for these encounters. CMS is currently working to design a measurement tool that will measure clinical performance, member experience, drug adherence, operational efficiencies. There'll also be performance measures for closing the encounter. There'll be a total of 44 measures across 5 domains. These domains are outlined as healthcare effectiveness, data and information set, consumer assessment and healthcare, providers and systems, health and outcome surveys, Part D, and operations. All these will be put into a matrix tool that will allow CMS as well as some others, AMA, to define a phenomenal healthcare experience via telemedicine. In addition to performance measures for closing encounters, the most common obstacles that were identified, CMS hired a Collier Healthcare Consulting Company to identify these obstacles that many people are facing that basically prohibit the closure of encounters. Some of the top ones were appointment availability for members of the providers, for members and providers opening. What that's saying is that you have a provider that has an open time slot on their schedule, however the member is not able to see them for whatever the reason. A lot of times this is due to the support that's required in order to set a telemedicine visit up. Claims are submitted without ICD codes and the appropriate CPT codes. This will count towards the measure. Provider specialty does not count for this measure. Certain measures do not meet date parameters, such as completion of child immunization on or before the second birthday. Members are assigned to the wrong primary care physician, and the information is not transferred to the new primary care physician accurately. Now we're going to get into the rating system that CMS is working to establish. It will be based on a star scale, 1.2 stars. You basically have a plan, a cap put on your plan. If you get between 3 to 3.5 stars, that's just saying that, hey, you meet the minimum requirements, good job, work to improve your efficiencies. If you receive 4 to 4.5 stars, that's saying that you'll receive 5% on each member per month of their reimbursement, the total reimbursement. 5 stars, saying that, hey, you're a stellar performer. You'll receive 5% per member per month, and you'll also have year-round open enrollment. All right, so I want you to take a note of that year-round enrollment. All right, so the calculation breakdown here. I know I said it's 1,200 patients per month, but we're going to keep it simple and say 5,000 patients per month. I think that's more realistic. So if you receive 4 to 4.5 stars, you'll receive 5% plus per member per month reimbursement. All right. So say, for example, you see 12 patients for the month. You times that by the 5%, you will receive a reimbursement of $60 as a reward towards that month. Now, currently, they're not saying what you can use that $60 for. However, you can also use it for provider incentives. You can also use it for telemedicine enhancement. So basically, reinvesting in technology to improve your current systems. All right. If you receive 5 stars, and you'll receive 5% per month per member, plus year-round enrollment. All right. So the reason why I wanted you to remember the year-round enrollment, because that's where you receive your kicker. All right. So say, for example, you receive that $60 a month, and you've been maintaining 5 stars. For the year, you receive a reimbursement of $720. So everyone who receives the 1 star to 2.5 stars, they will lose the patients that they have in their telemedicine pool, and those patients will be divided amongst those surrounding telemedicine providers in the area that receive 5 stars or greater. All right. So, for example, if you normally see 5,000 patients, the pool contributions a year, $720 will be times by that 5,000 patients that you receive from the underperforming star performers. And so that would equate to $3.6 million.